This segment of Delmarva Life is brought to you by Tidalhealth.
When you have an accident, say you get a deep cut or you break a bone, your first stop is usually the emergency department or an urgent care center. But what if the injury is not something that can be stitched or set in a cast?
What we're talking about is a behavioral health crisis. Well, that is where Tidalhealth Crisis Center comes in. And here to tell us more about it is Stacy Walker. She's the clinical manager of crisis services for Tidalhealth Peninsula Regional. Thanks for coming in.
Thank you for having me.
Okay, so first off, I guess we want to say congratulations on the opening of Tidalhealth Crisis Center.
Thank you.
What is it?
So think of it in terms of an urgent care center for your behavioral health needs. Okay. So walk in, always greeted by a warm smile and a behavioral health clinician, psychiatric nurse. Whatever perceived psychiatric crisis you're in at that time, we're going to do our best to take care of it or get you connected with someone who can.
So who do you serve? Who does the center serve?
Everyone and anyone who is in their perceived psychiatric crisis.
So walk in the door and you're there for them?
Yes, absolutely.
Oh my goodness. So does it feel like there's a growing need for behavioral health care?
Absolutely. And I think we can attribute that to Tidalhealth really getting out and educating the community and trying to break that stigma and just education that it's okay to not be okay and it's okay to ask for help.
So this is something that the Tidalhealth has been getting out and doing and building up over the years?
We have new programs that are opening, that have opened. We have some other things in the works that are coming up in the next few years to really be there for our community.
So it's a big outreach now to the community to say, hey,
absolutely,
this is going on.
Absolutely. The Crisis Center, we have, I believe we're up to 15 community partners that have partnered with us along with Atlantic General Hospital, who is our sister site, to help alleviate that stigma and be there and meet the needs.
That's incredible.
So how are you reaching out?
So Facebook, we have a great marketing team. Our community partners, word of mouth really has been the biggest promoter.
Getting the word out.
Yeah. So what other services does the health system provide?
So we do have an adult inpatient unit for those patients that just aren't safe and they need, a higher level of care. We have a child and adolescent partial hospitalization program that just opened in May that we're really excited about. We're getting that off the ground with school starting in, I guess, next week. Yeah. It's going to be a really big need. We have the crisis center, and then what we have, a lot of people don't know that we have, is a outpatient clinic, but there's more than one site. So there's the outpatient clinic that is next to the crisis center. We also have a small one in McCready that does behavioral health and substance abuse. And one of the big projects that we're kind of working on is embedding therapists into primary care offices. Yeah.
Nice.
So the big push for that is, you don't know where to go, so you go to your primary care doctor. I'm having anxiety, I'm having depression. There's such a backlog in getting patients into outpatient centers right now, so why not put a therapist into the clinic?
Where they need to be. So you mentioned stigma. How do you get rid of the stigma?
Education, education, education. Can't say it enough.
How so? I mean, what do you approach? How do you say it?
So you just want to let people know that it's okay. Like, if you have a heart condition, does that make you any different, than me? And so it's okay if you have anxiety. It's okay if you have depression. Educating on what the symptoms are, what to look out for, supports that are out there. I mean, recently we've seen more celebrities coming forward with suicide and behavioral health diagnosis. So I think that's helping as well.
So who's going to benefit the most from this service?
Everyone and anyone. Absolutely.
Yeah.
Just
that's amazing. Thank you so much, Stacy Walker with Tidalhealth, and congratulations again on the opening of the Crisis Center.
Thank you so much.